Welcome back to the ColersRx Healthcast, your trusted source for all things healthcare. I'm your host, Max Cole, and today we're discussing a topic that has become increasingly urgent in recent months: the alarming rise of whooping cough cases in the United States. Whooping cough, or pertussis, has reached its highest levels in a decade, and the latest data from the Centers for Disease Control and Prevention, or CDC, shows no signs of slowing down. This is a deeply concerning trend that affects everyone, especially vulnerable populations like infants and older adults. In this episode, we'll take a close look at what whooping cough is, why cases are rising, how it spreads, what you can do to protect yourself and your loved ones, and why vaccination is more critical now than ever. Let's dive in. Let's start with the basics. What is whooping cough? Whooping cough, medically known as pertussis, is a highly contagious respiratory illness caused by the bacterium Bordetella pertussis. While the early symptoms of whooping cough can resemble a common cold, think a runny nose, sneezing, a mild cough, and low-grade fever, it can quickly escalate into severe coughing fits that last for weeks or even months. These fits often cause a distinct whooping sound when the person struggles to breathe. The coughing can be so intense that it leads to vomiting, broken ribs, or exhaustion from the sheer physical toll. For infants, the consequences can be deadly. Babies whose immune systems are not yet fully developed are particularly vulnerable to complications like pneumonia, breathing difficulties, and even death. What makes whooping cough especially dangerous is its ability to spread easily through the air. Sneezing, coughing, or even close contact can release tiny droplets that carry the bacteria infecting others. And here's the kicker: many people don't even realize they're infected. Whooping cough can be so mild in adults that they unknowingly spread it to others, including infants and older adults who are at a higher risk of severe complications. Now let's talk about what's happening right now. According to the CDC, more than 32,000 cases of whooping cough have been reported in 2024 as of mid-December. That's 6 times more than at this time last year, making it the highest number of cases since 2014. The Midwest seems to be at the epicenter of this surge, with states like Illinois, Indiana, Michigan, Ohio, and Wisconsin accounting for about a quarter of all cases. Pennsylvania currently holds the unenviable title of the state with the most reported cases. Why the sudden rise? Well, it's partly because we're returning to pre-pandemic trends. During the COVID-19 pandemic, social distancing, mask wearing, and reduced social interactions helped suppress not just COVID, but other respiratory illnesses like whooping cough. Now that those precautions have largely been abandoned, diseases like pertussis are making a strong comeback. Another factor contributing to the surge is the drop in childhood vaccination rates. For the 2023 to 2024 school year, only about 92% of kindergartners received their DTaP vaccine, which protects against diphtheria, tetanus, and pertussis. This is below the federal target of 95% and leaves thousands of school children and the communities around them vulnerable. Vaccination is the single most effective way to prevent whooping cough. The CDC recommends the DTaP vaccine for children and the Tdap vaccine for adolescents and adults. However, even vaccinated individuals can experience waning immunity over time, which is why booster shots are essential. Grandparents and other adults who spend time with babies should especially consider getting a Tdap booster. Why? Because adults often serve as silent carriers, spreading the illness to infants who are too young to be fully vaccinated. In fact, babies often catch whooping cough from a close family member. Vaccination doesn't just protect you, it protects everyone around you. When you're vaccinated, you're less likely to contract and spread the illness, creating a shield of protection for the most vulnerable members of your community. This concept, known as herd immunity, is crucial for controlling outbreaks. While antibiotics can treat whooping cough, they're only effective if administered early, within the first few weeks before the severe coughing starts. Unfortunately, many cases aren't diagnosed until it's too late for antibiotics to make a significant difference. At that point, the only treatment is supportive care, plenty of rest, fluids, and comfort measures while the illness runs its course. This can be particularly grueling, especially for infants and older adults. So, what can you do to protect yourself and your family? Here are a few actionable steps. Number 1, get vaccinated. If you haven't had a Tdap booster in the past 10 years, now is the time to get one. And if you're a grandparent or caregiver planning to spend time with a newborn, this is especially critical. Number 2, vaccinate your children. Ensure your kids are up to date on their DTaP vaccines. Number 3, practice good hygiene. Wash your hands frequently, cover your mouth and nose when coughing or sneezing, and avoid close contact with sick individuals. Number 4, stay informed. Keep an eye on local and national health updates, especially if you live in an area with a high number of cases. At CoolsRx, we're committed to keeping our community informed and protected. We offer the pertussis vaccine for all ages, making it easier for you and your loved ones to stay up to date. As we've seen time and again, prevention is far better than treatment, and vaccines are a cornerstone of that prevention. As we approach the end of the holiday season, let's keep prioritizing health and safety. Whooping cough is a serious illness, but it's one we can fight effectively with the right precautions. Schedule your vaccination today and pair it with your flu shot. Whether it's for you, your children, or your elderly parents, together, we can help stop the spread of whooping cough and protect our most vulnerable. Thank you for tuning into this episode of the CoolsRx Healthcast. If you found this information valuable, please share it with your friends and family. Let's keep the conversation going and work together to build a healthier community. See you next time.